So over the last 7 weeks, I've never, I think, experienced anything like what we've experienced here, not just in the state of Michigan, but especially in the city of Detroit. The number of people I know personally who have been sick, the number of people I know who have died is staggering. The relentless nature of the news about people being sick and dying has been unparalleled. I'm at the point now where I'm almost out of words to describe what we're living through. There's nothing I can think of that compares. Nothing I've ever experienced, and there isn't some sort of convenient end that we can say is on its way.
Nolan, give us a sense of where you've been this last 7 weeks and how this has affected you personally.
Well, it's not so much that life has changed. It's basically just come to a halt. It's there's this sense that you're on hold, waiting for what next, waiting for the pause button to go off, if you would. I'm curious to see what this is going to be like when we do emerge, because we're going to have to soon. We can't continue this no matter what the risk. We can't keep living like this. Our systems are collapsing. Our food delivery system is collapsing. Our food production system is. We're going to have to reemerge at some point.
When we do come off pause, it's not going to be back to what it was. And I think that that's probably the most difficult part of all this, is not only do we not know where the end is, and if there's another wave coming, or that when it is over, it's not going to be the same, Stephen.
So what do you think the difference would be if we develop a vaccine in the next several months? How do you think that changes?
Well, I think that drastically changes it, but I think science will tell you that there's no way they're going to be able to develop a vaccine in the next couple of months. That it just isn't.
Doesn't work that
way. No, but if we reach toward the end of the year and there's a vaccine, because I do think these tests and everything are being fast-tracked.
The vaccine is what we're waiting for, right? That is the sort of turning point.
Yeah.
That makes it possible for lots of other things to happen. The idea that that's on its way inside of 12 months is fantasy. If you talk to scientists, if you talk to actual doctors who are working on this.
Here's the hard reality. We can't stay locked down forever or for even much longer, or there will be no structured society to return to. We have to return to some semblance of normal, and we do that by managing risk.
Well, I'm not quite sure we have any semblance of normal to return to. Stephen?
So when you say managing risk, that doesn't comport with the nature of this infection. So college campuses are a great example. You say young people who are in college are, for example, not affected, as that we know of at this point, by the disease. That's true. But a college campus is not just the students. The people who teach at those colleges have to be there too. The people who clean the buildings, the people who run food service, the people who run all of the support systems on a college campus are adults, and all of them are at risk. This idea that somehow you can divide people into categories of risk and non-risk doesn't work for a disease that is infecting everybody. The issue is
it's not infecting everybody, Steve. It's like
it is.
A very low percentage of the population's been affected. And I think if we minimize the panic over this, first we can assess the steps we have to take to responsibly reopen our society.
It does infect everybody. It can infect everybody. Everybody.
But it hasn't.
Hold on. Everybody is a potential carrier of the disease. And so, as opposed to saying, well, this person is affected in this way by the disease and this person is not, the proper way to manage it is to keep it from spreading. And that is what has made a difference in states like Michigan over the last couple of weeks in bringing the numbers down.
But this is not sustainable.
Well,
this is not sustainable.
What is sustainable?
We're not.
The idea of risking other people's lives and deciding whose life is worth risking is
And
terrible policy.
And that's, and that's easy to say for three people who have paychecks still coming in. You got a lot of people out there with no paychecks coming in, no way to,
it's not easy to say for people
no
who are
way to think that the government's going to keep supporting them forever.
Nolan,
I mean, we've got to reopen this society.
Nolan, money losses don't equate to mortal losses. If you talk about people up north, people in places where there is nowhere near the hospital capacity, getting this disease in large numbers, the death toll for them as a percentage will be much, much higher. The danger here is off the charts. And so this idea that that this mass of death in places like Detroit, in places like New York, in dense places, is somehow not getting the concern that it should from some quarters is one of the most frightening and disrespectful things I have ever seen.
How difficult has this been to talk about this?
Well, I mean, I don't think it's difficult to talk about. You have different opinions, and I think it's important to air them. I think there's not just one approach here or one way of dealing with this. I mean, I think it's wrong to say people don't care about the folks who are dying. Of course, people care about the folks who are dying, and I don't think there's anybody who hasn't been impacted by this. I mean, we all have loved ones who have lost their jobs because of this, who have gotten ill because of this, who have died because of this. This is going to be a long, hard slog coming back from this. But, we've got to start figuring this out.